time. We're starting the session again. So please take a seat. And we're going to tell you about blockchain and impact. So you've heard a lot about blockchain. It's like becoming, it's a very hot topic. And one of the cool things that blockchain enables in healthcare especially, it's like when you mix it with impact, more people can have access to healthcare. So I will let my panel discuss that very interesting topic, and I will let Carl introduce the panel.
Hello. Hello, everyone. Welcome to our panel. You won't believe it, but we have more than 40 sessions on healthcare in general at the entire South by Southwest conference, and over 50 sessions on blockchain and decentralized networks, etc. And you guys probably did choose wisely because you have the only panel that I could research that is combining blockchain and healthcare. So you can be very fortunate on that. And the broader topic of today is blockchain for impact in healthcare. And we have 4 very interesting experts around here. And I give you a quick opportunity to introduce yourself, and then we aim to setting the stage to quickly define what's blockchain about, what are key advantages, what is the current state of healthcare. Before we are going deeply into the use cases each of the experts are working on, that is hopefully answering a lot of questions why it is very necessary to talk about blockchain in combination with healthcare. And afterwards, of course, we are opening up the discussion, and we introduce any one of you to raise questions and, yeah, to jump into the discussion as well, right?
Oh, me first. All right, I like this. Did you want me to start? Is that what we're doing?
Yeah.
All right, okay, there we go. All right. Well, good afternoon, all right, everybody. My name is Aman Quadri. I am the CEO of AMSYS Blockchain and Emerging Tech, which is actually based here out of Austin, Texas. So welcome all you guys from out of town to this hot, muggy weather you're having here. I am also the Chief Strategy Officer of the AMSYS Group, which is a 15-year-old company that's based out of Houston, Texas. We have lots of initiatives in blockchain and emerging tech. Some are of our own. In healthcare, we also develop initiatives for other organizations. We have several projects of our own running in India. We're working on a project in the Philippines, and I will also talk about a very unique project using blockchain as a use case in defeating the blood mafia in India, as well as some other use cases that we're coming across in the United States.
Hi, my name is Grishin. I am co-founder and chief scientific officer at Nebula Genomics. We are a privacy-focused personal genomics company. What it means is that we are offering genetic testing services to our customers, but in contrast to many of our competitors, we actually do not take ownership of that data, but rather empower our users to remain in control of the data and share it themselves in a very transparent, controllable, and secure way. And to enable that, we use a number of privacy-preserving or transparency-creating technologies, and blockchain is one of them, which we use to enable a very efficient and transparent consent management, as well as access control.
Hello, everybody. My name is Jürgen Primbs. I come from Munich, from the Ludwig-Maximilian-University and the hospital there. And I'm the chief of the new technologies, internet and intranet there. And what we have done, we have built a new platform where doctors in private practice can interact with our hospital, GDPR conform. And I'm not a blockchain specialist, but I'm very interested in, and we have done some evaluation concerning blockchain firms, because we have one use case, a special use case, perhaps later we can speak about, where I can imagine we can do a small step.
Hello everyone, my name is Shamala Hinrichsen, and I run a very small startup at the moment, and we are focused on bringing healthcare information and access to rural and marginalized communities. We have small pilots running in the south of India and in Mozambique, and we utilize some of the bigger deep tech methodologies, but they are methods in the vastness of our work.
Thank you a lot. I guess we all heard about blockchain. It's coming across quite frequently, but just to bring some context to that panel, I like to ask Dennis again, like, can you, from your understanding, what is blockchain, right?
Well, so blockchain is essentially a database that has a number of specific properties that most databases don't have. So first, it's a distributed database that is maintained by a network of entities, which each of them essentially having a whole copy of that database. So that's the first property. The second one is that how the process of adding new information to that database is regulated. And in case of blockchain, a consensus must be reached between those entities maintaining the database before any new entry can be added to the database. So that's the second property, that is depending on consensus. The third property is that it's immutable, meaning that entries that have been added to the database previously can no longer be removed from it. And the maintainers of the database make sure that no modification of past entries is possible. And those three properties make blockchain into an interesting technology for different kinds of use cases. Bitcoin was the first one, where those entries to the database were simply transactions between multiple parties. But it can essentially be used for any kind of transparent and immutable record keeping. And anything can be those records. In our case, for example, it's the consents that people give who want to share the data with researchers, but it can be anything.
And I guess even from the explanation, it becomes already quite obvious what are the key advantages, right? So, and I would like to ask Shamala to quickly elaborate.
I think probably where it fits in quite well is if you look at what are the big problems in the healthcare system in general. So one of the things blockchain can help with, it's actual healthcare setups within an entire hospital where you need this immutable and blocks of information going through. It also plays a role when you want to look at data security, and it's quite crucial when it comes to individual patients and how you give the empowerment back to them through their empowerment of their own data. It's also quite useful when it comes to things like drug traceability. It's quite an important one, and the blockchain definitely can help in verifying those things. Also, one of the bigger things, it's how you pay for your healthcare. That's a large gap between the patient and the hospital setup, if you want to call it that. There's always a middleman / insurer. That's in the more developed settings, it's an insurer, but in other countries it's something else or something you cannot trace. So the blockchain definitely plays a role in coming in and trying to solve that gap. That's probably what I could think of very quickly, and I'm sure someone else can jump in.
And Aman, to jump into that topic, you are working with emerging tech for quite some time. You are working on different projects at the same time. Maybe can you just give us a wrap up? What do you see on a more meta level? What's going on with blockchain in healthcare, or how ready is the healthcare industry in general to work with blockchain?
Let me summarize this by saying blockchain in healthcare, what's going on with it? Not much. And I'm going to be the protagonist here. There are a lot of people out there in the space that are using blockchain and emerging tech and other buzzwords, saying that, hey, this is going to solve a lot of problems. Blockchain is one piece of the puzzle that can actually help to solve certain issues. Over the last year and a half, now we run a hedge fund ourselves, so we invest in other companies. We've seen a considerable amount of companies who've used these same buzzwords in healthcare, and now a lot of these companies have disappeared. A lot of these companies that come in and say, hey, look, blockchain in healthcare, we'll actually do a project on it. But in healthcare organizations, sales cycles are slow, so the difficulty of penetrating those is difficult. To finding a pilot partner or an organization that's saying, okay, what are you doing differently and how is this going to impact me? And the other part of it is because we've used blockchain interchangeably, and a lot of people have with cryptocurrency, it's created a sour taste in people's mouths saying, oh gosh, I don't want to be involved in payment ideas that are related to a different currency than what blockchain is. And so what we found is is that, yes, there have been a lot of companies, and a lot of those companies have disappeared, but now we're starting to see the rise of companies that are actually doing use cases out there. And use cases when we come to payment reconciliation, supply chain management, going after the opioid crisis, things like trying to do credentialing on blockchain. And we can always talk about some of these use cases in more detail. But there's some cool companies, not just ourselves, that are doing some really nice things that actually blockchain can solve, even including genomics. Right? So I think what you're finding is that over last year, things are dying down. Now things are picking back up, but these are quality companies that are picking back up. And so that's good to see, right? So.
And I guess you brought it already to the table, right? Blockchain is one piece in the big puzzle of healthcare system. And the next part of the panel will be a bit more detailed on specific use cases each of you are working on. And I would highly ask you, Jürgen, to give us an idea what you are working on right now. What is the problem you are trying to solve? What is the solution you are providing, right? And I guess this topic around blockchain as one piece in the big puzzle highly reflects what you are doing right now.
Okay, since until now we have developed a platform, a pilot platform with one use case. The doctors in private practice interact with our clinic, and the patient data must be transformed or shared with the clinic, sure. And data security and data safety is the thing we are interested most in, and therefore we have done everything we can do in this situation with asymmetric and symmetric encryption and so on. But the problem we have is that we have no history, or we think the possibility of blockchain can enforce or can enhance our solution. And the use case, for example, we think about to do a pilot project with a blockchain is, for example, if a doctor in private practice make a contraction with the clinic. Afterwards, the patient do a patient consent, for example. Then there are some preliminary investigations or diagnosis must be sent to the clinic. The clinic have, for example, some special investigations, or the patient come in total to the clinic. And after we have done our job, then the patient go back to his doctor in private practice, and we have a doctor letter, and the doctor letter, and so on. And we need, for example, a control over the whole process from outside the clinic, in the clinic, and back. And I think blockchain is a very good possibility to develop this process in the digitalization process, and that's our idea. And I've mentioned I'm not a blockchain specialist, but we have read something, and this is a small use case, and a use is not far away from here. It's a small step for us. It's not a big picture, but it's a small step for us. But in the interaction with our private practices is perhaps a huge step. Because since 20 years, it's no possibility to transfer or to share information between these both parties.
Very interesting. And one just quick follow-up question on that. Aman, he said, right, sales cycles are tremendously long in the healthcare system in general, and you are a representative of one of the biggest hospitals in Germany, if I'm not mistaken. And maybe to follow up on that, what's your perception on the C-level in such a hospital at yours of blockchain, of decentralization of systems, etc.?
We in Germany and Europe, we have a special situation too, because data security and data safety is a huge project. And I think, especially in Bavaria, where I come from Munich, we have a hospital law. The hospital law says the data must be inside the hospital. Decrypted, encrypted, it's egal. What is egal? Okay, it's not that's not better, and therefore I think we only can have a pointer or a pointer in the blockchain, and we must have this silo or silos in the hospital, and only the pointer and the contracts and the administration can be in the blockchain. And yesterday I have heard a very interesting lesson here in South by Southwest, and the title was Preventing Cambridge Analytica in Digital Health, and it was really great. And I think we have to do a small step, really sure, in Germany or in Europe, and then we can must evaluate this step, and then we can do the next step. And therefore, I think it's better to train and to learn with the blockchain technology so early as is possible.
Can I, in that hospital system, and I'm unaware, does the data belong to the patient or to the hospital, or to, how does that work over there?
The data belongs normally to the patient, but if he comes to the hospital owns the data.
I guess this is a super interesting project, right? And this depicts how the more corporate pilot setting maybe looks like, and I guess a very interesting use case around that is definitely what Nebula Genomics is doing, right? Since democratizing health data is probably pretty much on the opposite side that just Jürgen was telling us, right?
Right, so our goal is essentially to make genetic testing as secure as possible, and blockchain is actually one just of multiple technologies that we're using. So it starts with kind of data generation. How can we sequence people without ever knowing who they are? How can we do it anonymously? And there are kind of multiple challenges with that. Payments have to happen anonymously. We need to collect the sample anonymously. And then there are also regulatory challenges because we need to return results to them without actually knowing who they are. And this is, at least in the US, not that easy. So here blockchain can potentially help with the anonymous payment part. Now then the second part, after the data is generated, we actually also want to encourage data sharing because that's when the value is generated. And we want to enable our users to share the data transparently, securely, controllably. Here blockchain also plays a role by essentially being this ledger through which access permissions are managed. So the way we're implementing it is that different nodes encrypt the data using multiple keys. So it's distributed key management that we use. Those permissions are essentially managed on the blockchain. So for example, when an individual agrees to share data, he adds an entry to the blockchain. All those key holders read out the permissions from the blockchain, collectively decrypt the data, and make it accessible. So that's the second part. And the third part is that once you share the data, how do you make sure that the data is not misused or used only for that intended purpose to which you agreed? And here, different types of technologies come into place, generally called privacy-preserving technologies, and which are based on different cryptographic methods that enable some computations to happen on encrypted data without actually ever decrypting it. So this is unrelated to blockchain, but it's a very important part of this whole system.
I guess it's a super exciting project, right? But can we talk about the numbers behind that? How many people are using Nebula Genomics, and what is their big incentive to do it?
Right, so we launched the first version of our platform 3 months ago. I do not want to give exact numbers of users, but we have tens of thousands of registered users and many thousands of actually paying customers who purchased genetic testing through us. And we did a survey and asked people, why did you use us instead of many competitors that exist? And the overwhelming majority of people said that because of privacy concerns, that's the reason they have never done it before and now doing it with us. So we think that we're really pioneering an emerging market here.
Sure. So I guess this is a very exciting project from my perspective. I was very fascinated when I was reading through it. And maybe, Aman, you can go into that as well, since like the broader space I see some overlaps, but maybe you can give some more details on
First
that.
of all, congratulations. To see a good use case in blockchain and then be successful and be launching in 3 months is awesome. So congratulations to you guys over there. We have a couple of projects running. So the first thing that I'm going to tell you the first thing I believe. I believe every patient should own their own data, and they should have access to it at any point in time in their life. Right? And I believe that longitudinal data is really, really vitally important. We have an advisor on our platform. She works for the NHS, and she has a son who has a rare genetic illness. But the NHS doesn't allow her to take his medical information and bring it to India or someplace else to get it examined. And I don't think that that's the way the world should be, because he generated that data and it should belong to him. So what we did was we created a product called AMCHART. It is a ecosystem of healthcare products. It consists of an electronic medical record, it consists of a personal health record, and a mobile application. Basically, in a nutshell, if one of you goes to a physician and says, oh, hey, you're diabetic, we need to monitor you, you guys come up with a set of goals. These goals go directly into the mobile app, and as they monitor you through IoT and connected devices, if you're meeting your goals, you get awarded some points. It's not related to crypto. If you don't do the things that you're supposed to do, it sends an accountability kind of loop. So alerts to your family member, alerts to your doctor, alerts to anybody else. And what we're doing is, with your personal health record, you're creating a longitudinal database over time, which then you can monetize, your data, throughout whichever marketplace provider you want to within our marketplace, right? So it could go to a partner like Nebula Genomics, where if you want to get genomic data, we can push you towards that to do anonymous genomic testing, right? So our goal then is, how do we use blockchain? Well, one, we're on a hybrid platform. We use Hyperledger Sawtooth as our main engine, and we use smart contracts on Ethereum. That's how we run a lot of things. So we use it for role access control. We use it for security audit trails. And we also are saying, hey, look, we have data coming in from the provider through the AMR, from you on your personal health record, and from your device. And so if you say that the device matches what goes into the personal health record and you verify it, or what comes in from the EMR is verified by the doctor, those things create a hash reference on the blockchain. We don't store any electronic health records on a blockchain, just the hash references, and that goes into our AI platform. Our artificial intelligence platform over time will start telling you things about your own health that you need to follow and manage, right? So that's how we're using it. The second use case we're doing is, in India, there's 1.2 billion people, but only around 4.5 million people donate blood. Now, we're working with a provider over there, the Indian Red Cross being one of them. When people donate blood and that blood is transported, it gets hijacked a lot of times. There are things called blood mafias there. And on average, $45 million a year is spent buying back blood to get it to a recipient. So our goal is what we're doing is we're working with two organizations, putting IoT devices and GPS trackers on the blood, monitoring every step of that supply chain on blockchain. And so we know where it goes from donor to recipient. If it's captured, we know how we can track it. So that is done with a separate organization, but we feel like we can go tackle a project using blockchain and other emerging tech to destroy this whole blood mafia thing. And that's one of the cool things that we're doing. So.
Very interesting as well.
Fun stuff.
Amazing. Since we are already basically in India with the solution, I guess Shamala, she can go into
Close
her
it,
project.
girl. Close it.
So when Hanai grows up, it's going to become like AMSYS. We tackled the whole thing, or the way we came into it was just by spending time in India and looking at what some of the problems were. We didn't go into it thinking we're going to use blockchain to solve something. We said, let's take a look and see what are some of the small things we can start to resolve. In some of the, or at least because I'm a stakeholder in the whole situation myself, I began to notice mothers who would not know exactly what to do about their children's health because they actually did not have the information or did not have access to the hospitals. Or began to notice nurses or midwives or doctors would have to spend, walk up to 20 kilometers, 10 miles or so, something like that, to reach people in a day's work. So there was that issue. People would not go to the hospital. And on the hospital side, they did not know how to get back to their patients. If there was a dysentery outbreak or a cholera outbreak, they would not know how to reach the community to quickly engage them to take measures because it takes so long just to reach people. But one of the things was everyone we met on the field had a smartphone, had a mobile phone, and they knew the ins and outs of it. Then you know what to do with it. So we started small, one very small area with 3,500 women in a community and a closest hospital. So we engaged that hospital to work with us and asked us if they'd get on board with it. So a couple of aspects to it. One, getting the information to the women, which was crucial from the hospital side. And secondly, having a payment system which was not corrupt, or at least we tried to minimize the corruption level or make sure that the money just doesn't go lost, because people wanted to donate towards this women's health, but at that same time the money could very quickly get, just slip through the fingers. How do we trace exactly what happens with the money? And one of the things that struck me is women would not talk about sexual health problems, for instance, because it's such a private thing, and they would have it and die with it eventually. But if we could provide a platform where they could chat with the hospital almost anonymously, to a certain degree, that we immediately empowered. Someone said it in one of the earlier talks. It's like make people the stewards of their own health, and I think Hanai is driving that with rural communities and marginalized communities who actually don't even know that the rest of the world exists on this fancy schmancy insurance schemes and what have you not, especially if you come out of Germany. You never have to think about it. But these people do not even know that such an ecosystem even exists to begin with. So we've started very small. The blockchain part of it is still very minimal in that huge picture. It just tracks one small part of it. Right now we resolved the payment system, which goes completely cashless through it. We're trying to make sure that the way the information comes back from the hospital to the people building on blocks of that. One of the fun things we're doing now is the geospatial data, like for instance, if an outbreak happens, trying to monitor that and have that ping on your phone to show where exactly it's happening. The community of 3,500 is large enough to start doing that, and sort of envisioning forward into like emergency situations and earthquakes or floods, and especially in these areas which are densely populated. Yeah. So it's very exciting times, and I do hope that a year from now, it will not be a case that we were another blockchain company that went bust. We can't go bust because we don't have money anyway, so we just can only become better.
Very interesting. Thanks a lot. So we have 4 very specific use cases how to use blockchain in combination with healthcare. And I would like to open up the discussion to the audience as well, right? So I guess we have a lot of questions about the future development of blockchain, what's going on in the healthcare system. Are we going to end up in a very decentralized healthcare ecosystem as Aman was suggesting it? And of course, I want to engage you guys to raise questions as well. So if anyone in the audience has a question, feel free to ask. I can... Anyone?
Hi. So I'm curious, have you all worked closely with any of your legal and regulatory teams, and what advice and direction has sort of resonated with you all so that your company's not necessarily hindered from innovating, but it kind of helps strategically to move forward?
So can I restate the question because I didn't hear it all the way? You were saying that have we talked to some legal teams?
Yeah, so how has your legal team sort of helped you guys be partners in innovation, and what advice has resonated with you all rather than it being regulatory aspects being a roadblock into creating?
Well, first thing I'll tell you is that our legal team budget is much higher than I'd like it to be because this is the way it works. But there are legal organizations or law firms that we work with directly that are healthcare and blockchain, surprisingly enough. Some of them are out of Nashville, which is a huge hub for healthcare. One of the things that we looked at, there's so many in the United States, that's where we're based. There's so many legal hurdles that you have to deal with data privacy, and don't get me wrong, we follow those things, HIPAA compliance, all that kind of stuff. So when we wanted to create the avenue of testing all our initiatives, we said, you know what, it's just gonna be easier if we just go outside of the country. And so we launched our own clinic in the middle of Mumbai, India. Say, nobody can tell us no. So we did that to kind of circumvent some of those things so we can test out those initiatives and responsible AI and responsible data management. One of the things that we did was we created a foundation. It's called Blockchain in Healthcare Global. It is done in conjunction with an organization called IEEE. Most of you may have heard of IEEE. They've created the rules and standards around Wi-Fi and other things. Well, they're getting into blockchain too. And so some organizations like Consensus, us, Cogent Law, a bunch of other organizations are coming together to create legal frameworks around responsible use of blockchain. And so it's based out of DC and some of the other ones. So you're going to see a lot of governance stuff come out of that in the near future through blockchain and healthcare global. So I don't know if anybody else.
And similarly, because we were originally a Berlin-based company, just given the data privacy and GDPR and all the different regulatory constraints, it was getting very smaller and tight. And when we ran the project out of India, it was a different set of rules, which is, yeah, it's not that we're running Renegade or anything, and eventually we'll have to follow different structures that are coming out. But at least from the original standpoint and keeping to the laws of it, we're there.
I'll tell you one more thing. So one of the things that legally we learned that's the best practice is that if you're going to do stuff outside of the country or even in the country that you're practicing in, make sure your data resides within the geographical boundaries of that country. That's the one takeaway I want you to have all this. When we do work in India, all our stuff is in India. When we've done stuff in like Nigeria, it's only in Nigeria. Now, is that necessary? No. But I think you're going to start to see more responsible data usage, and that's one of the things that's going to come up is geographical boundaries of data. So.
For those of you who are in Germany, how do you handle the right to be forgotten and the right to erasure under the GDPR and the BDSG? How do you guys handle the right to be forgotten and the right to erasure under GDPR in Germany and the BDSG?
You guys take this one. There you go.
Can you repeat your question once again?
The GDPR has the right to be forgotten and the right to erasure, but the blockchain is immutable. You can't erase things in the past. If somebody wants to take back their data or revoke consent or something, how do you guys handle that with your processes now?
I'm not a blockchain specialist, but data security and data safety is a very interesting question. In Germany, in this moment, GDPR, very famous, and in this month, for example, the German health minister make a law that the health insurances must have the data. And that's a problem because the GDPR has normal regulations or normal specific efforts you have to do. And therefore, I've tell you before, the big picture is very difficult to realize some projects with GDPR conformity. And if we pick a small part of it, our use case, for example, then I can imagine you can develop a platform or a software product GDPR conform. But you have to do all the things in GDPR solutions and therefore the data must be in the clinics in Germany. That's a problem, and if you do so, then it's no problem. And therefore, I think there are some small use cases, and we have to test these use cases to evaluate the blockchain technology, and then we can learn about the smaller projects, and then we can go step by step.
We don't do business in GDPR countries. How about that? So, here's my problem with it, right? Is that let's say you have large swaths of data, people that have rare disease conditions, et cetera, and they are part of GDPR countries, and they say, I want to be forgotten. Imagine taking those data streams out of research scientists' hands and the ability to create new drugs or new interventions because we're taking those data sets out. That's what bothers me long term, is that those kinds of things can happen, right? So, but But it also comes down to how do we store data? Do we put identified data on a blockchain? I hope to God not. You're doing that because that's a bad idea. But even if you put de-identified data on there, the right to forgotten says everything needs to be scrubbed technically. There's a gray area there, and we've talked to legal about it, and those things haven't been fleshed out yet, so that may be a tough thing. So.
We have an...
But you have right. For example, in Germany, it's not allowed to do data mining with different kind of data, for example, from variables or from some apps. It must be medical apps. And then you have a chance to be GDPR conform. A solution like here on the left-hand side, I think it's not possible in this moment in Germany.
Yeah, so some companies have to circumvent the GDPR by leaving Germany.
I'm curious about the portability of patient records. It seems like there is no standard ledger at this time. So if we have company A with one ledger recording a blockchain and company B recording a separate ledger, is there any transferability between ledgers?
We don't store the entire data record on a blockchain, right? So, I mean, our system is that we store hash transactions of de-identified data on a blockchain, and then we store the identified data off-chain right now, is how we do it. So, if there is an organization that is putting an entire record on there, that's going to be a problem for transferability and operability right now. So that's not a recommended thing we do. The way we have done it, because we've separated out both these devices in essence, our health record can connect to another health record if they expose APIs or if they have a FHIR HL7 integration, right? You know, so we do that. The other thing we're also doing is we're working with HIEs here in the United States, health information exchanges, where a lot of this data is dumped by multiple electronic medical records. So I don't really care which medical record they're on, as long as I understand the data scheme on the back end, then I can create something off of it. But I don't think that right now we're in a phase where we can actually do that. There are companies trying to do that. The problem with it is access to that data is really, really slow, all right? And most of them done on permission ledgers, not on public ledgers, just because, well, you would be exposing a lot of information on a public ledger, right?
So guys, 3 minutes left, and I would allow myself to ask the final question on that. And I would be very curious about, we talked a lot on advantages of blockchain in general, data privacy, transparency, etc. What's coming when blockchain is not the go-to technology for decentralized networks anymore? What's happening when quantum computing is so good that blockchain transactions could be rewrite so quickly?
Boy, you had to bring quantum computing into this thing. All right. So, is there a possibility of there being, I guess, improved technologies that could go hack it? Absolutely, there could be. But it's how we're responsible with the current data that we're giving is going to be the key, right? So if we're using off-chain storage for identified data sources and putting de-identified data, I think we still have a ways to go. And I think that as those quantum computing technologies evolve, there are also going to be other cryptographies that evolve. I mean, I think zero-proof knowledge and all these kind of things that are coming out there that are really pretty unique in the space that blow my mind when I start reading about it, I think can circumvent some of that stuff. But I am not a data scientist, I'm not a cryptographer by any means. I'm just a lowly guy trying to build a lowly product. That's all I'm trying to do, so.
So to get back to quantum computing, it's not something we are super concerned about, but I mentioned before that we do care about encrypting the data and computing on encrypted data and so on and so on. And the scheme that we use, the encryption schemes that we use, aside from enabling us to do that, it's actually a quantum-resistant encryption scheme. So in contrast to the schemes that I use today, that are essentially based on factoring of large prime numbers, that scheme is based on operations in lattices, so-called lattices. And that scheme turns out to be resistant to quantum computers. And so it's believed to actually be also the encryption of the future. Once we have quantum computers, by using that scheme, we'll still be able to encrypt and protect our data.
What he said.
Okay, for me, I think I feel or I am convinced that the blockchain technology is worth to investigate in clinical and in medical health sector, but we are in Texas, don't mess with medical data. That's a thing we are interested in, but the wonderful possibilities and the chances we have with the blockchain technology, therefore we had to do.
I think when it comes to having other technologies that are going to come up and do it, I would say I welcome it. I'm very promiscuous when it comes to the technology. I was new to the game with blockchain anyway, and it's just one very small part of my project. I think I've stressed it like a million times just on this panel. And whenever something new comes up, I think the problems that need to be solved will find the solutions that they need, whatever it may be, not just necessarily the latest buzzword.
So thank you guys. Thank the panelists a lot for the interesting talk. I'm very convinced that we identified nice use cases, and I guess next will be drinks, right? So this is not too bad. Enjoy the evening.